Apat sini ang though minimal lang ang symptoms na makakos sa mga human being sa tao. So these are your HCOV229E, your human coronavirus NL63, human coronavirus OC43, human coronavirus 3, and human coronavirus HKU1. So these are the four coronaviruses that causes a minimal to moderate symptoms in human being. So there are three more, and these three causes more severe, fatal, and respiratory infections in human. Before we proceed to these three, let us first define endemic, outbreak, epidemic, and pandemic. So what do we mean when we say endemic? See for a while. Okay, so what do we mean when we say endemic? We get to say that the disease or that characteristic is endemic if it is only present to a certain particular group. It does not affect multiple countries. So, as what happened in COVID 19, before it became pandemic, it was an endemic. Endemic in Wuhan, China, specifically in a seafood market. So, there is a history that all who got sick, all who feel ill, has history of going to the seafood market. So tanan sila nagkasakit on that area. So it is called endemic. An endemic becomes an outbreak if endemic is not properly controlled. So there is an increased number of endemic in neighboring provinces, regions, and in the same population. There are infection in other countries, but very minimal. There are infections in other countries, but they're minimal. So example of this outbreak is your dengue outbreak in Southeast Asian countries, your Japanese encephalitis in India, your Nipah virus in India, and also dengue outbreak in the Philippines. If the outbreak is not controlled, it becomes an epidemic. It would affect a large number of population within a country or a region. So if this epidemic is not properly controlled or not properly contained, it becomes a pandemic. An example of your epidemic that happened during the past years, is your Japanese smallpox, your typhus in Russia, your Cocolus or your Great Pestilence. It is secondary to a Salmonella enterica and your Ebola virus. If this endemic is not controlled, it becomes a pandemic, an epidemic that has spread over multi countries. So around the world, across the continent, example of your pandemic is the bubonic plague that happened 100 years ago, your Spanish flu 100 years ago, your HIV AIDS, your cholera, and the current pandemic that we are experiencing is the COVID-19. Now let's go back to the coronavirus. As what I have mentioned a while ago, there are four coronavirus. These four causes minimal to moderate symptoms, minimal to moderate infection in human, but there are three that causes a more severe infection, and this is your number one, your MERS-CoV in 2012. If you can still remember your MERS-CoV, your Middle Eastern Respiratory Syndrome coronavirus, it surfaced in 2012. It is not considered an epidemic and was not considered a pandemic, but it is only an outbreak that happened in the Middle East. It originated in Jeddah, Saudi Arabia. It is believed to be the virus is carried by a bat. A long time ago, the coronavirus is the carrier of the coronavirus is bats. As years go by, these bats infect camel. These bats infects camel. Maybe siguro maging kaon ang camel nga mga fruits or any food nga na-contaminate sang pupo sang bats, or maybe may mga food nga nakaon ng camel nga ginkan-an man sang mga bat. Amo na guro naa na infect ang mga camel in Middle East. Now, paano na-infect ang mga human beings? It is secondary to consumption of uncooked camel meat. Take note. So the people in Jeddah, Saudi Arabia, basi during that year or during that time, they consumed a uncooked camel meat, or consumed a camel milk that has not been pasteurized, that has not been cleansed, or maybe a direct, excuse for a while, or maybe a direct contact with a sick camel. So as you can see here, a Middle Eastern man kissing a camel, or could be this man nagsakay sa likod sang camel. So nalatnan siya sang MERS-CoV. The second is your SARS-CoV-1 that happened in 2003. So maybe during this year, kasi you are still in elementary, during this time, college kami, and we are preparing for, nag-outbreak siya between 2003 to 2009. So during that year, we are preparing for our board exam, 2009. So your SARS-CoV-1 in 2003, it is severe acute respiratory syndrome, or otherwise known as your SARS. It occurred in China, to be specific, in Guangdong, China. And then it was totally eradicated in 2004. Now, question, diin naman naghalin ang coronavirus sang SARS-CoV-1. It is believed to be from bats and from civet
Cats,
cat.
mere cats. Like,
Civet cat. So could ang civet cat basi ilagin slaughter, and then they consume a an uncooked meat sang civet cat nga infected sang coronavirus. And also bats, same also as what happened in MERS-CoV, basi maging kaon ang tawo sang fruits nga ginkan-an sang bat, or could be ginluto nila ang bat kag ginhimo nila as a dish. And the current pandemic, your SARS-CoV-2, your SARS-CoV-2 is the one responsible for COVID-19. When SARS-CoV-2 surfaced in 2019, it was called novel coronavirus. Why novel? Because it's new. Every time a virus would surface, so they would call that virus a novel virus. Novel because it is true. It happened in Wuhan, China in late 2019 and spread worldwide. So it is believed to be also coming from bats. So the carrier of the virus is bats, and as well as your pangolin. So what happened with pangolin? So they made it as a industrial, for industrial uses, or could be consumption of uncooked meat of pangolin that was infected with coronavirus. That is that's the reason why SARS-CoV-2 occurred in China, or happened in China. Your SARS-CoV-2, your coronavirus is believed to be zoonotic in origin. So what do we mean when we say zoonotic in origin? The virus always starts in animal. So when we say zoonotic in origin, ang virus halin sa sapat halin sa animal. Now, what is this spillover event? Spillover event is what happened when the virus inside the animal jumps into the human. That is spillover event. Now, let's discuss SARS-CoV-2. Your SARS-CoV-2, it surfaced in seafood market in Wuhan, in China, on 31st of December 2019. It got its provisional name 2019 novel coronavirus or 2019 nCoV and has also been called your human coronavirus 2019 in January 2020. It is a novel virus, as what I mentioned a while ago. It is novel because it is new. And in February 11, 2020, it adopted the name of SARS-CoV-2. Why SARS-CoV-2? Kaya ang una nga SARS-CoV-1 natabo na in 2003. Now, your SARS-CoV nag-resurface what? In 2019, it is now called your SARS-CoV-2. So the virus that causes your COVID-19 is your SARS-CoV-2. Now let's discuss the disease, the COVID-19. Your COVID-19 is an infectious disease caused by SARS-CoV-2. Symptoms could be mild to moderate depending sa edad sang tao, depending man sa kung ano ang medical problems ng isa ka individual. Symptoms could be mild to moderate, could be severe, but in older patients and those with underlying medical problems, symptoms could be severe and they could experience critical, yes, they could undergo critical situation. Your COVID-19 is a public health emergency. It was declared public health emergency of international concern in January 3, 2020 by World Health Organization. It got its official name in February 12, 2020, and was it was later on declared as pandemic in March 11, 2020. So if you can still remember, March 18, it is where Philippines declared a nationwide lockdown. Now let's talk about infection and transmission. How can you be how can you be infected with coronavirus? How is coronavirus transmitted? Number one, it could be droplet transmission. What happens with this droplet transmission? If a person infected with coronavirus, with SARS-CoV-2, that person talks, speaks, cough, sings, smoke, vape. So when that person talks, droplet nuclei gets outside the mouth. So these droplet nuclei, the nuclei contains a lot of virus. What happens to the virus? Some of this virus stays in the air or being sprayed on the air, and some of this virus gets into the surfaces of the table or on the floor. Now it becomes airborne transmission. It becomes an airborne disease if that person, a person who is not infected, inhales the virus, inhales the droplet nuclei. There are still questions until now kung ano gin man bala ang mode of transmission ng coronavirus. Until now, it is still a question mark. Your airborne transmission usually occurs in the hospital. Airborne transmission usually occurs in the hospital. Why? It is when they would perform aerosol generating procedure, AGP. What is this aerosol generating procedure? So if a COVID patient would go intubation, so meaning butangan tubo ang iya nga baba para mag-drive sa oxygen pasulod sa lungs. So the moment the tube is inserted sa mouth, a lot of virus goes out sa baba. So the virus is being suspended in the air and becomes an airborne. Another example of aerosol generating procedure is when a person gets inhalation. So asthmatic patient, kung mag-nebulization sila ba na? So if a COVID patient would undergo nebulization, so kung mag-exhale ang patient mo, may gaupod gwa ka mga virus sa iyang baka. So the virus becomes airborne. Now let's go back to droplet transmission. With droplet transmission, it becomes an indirect contact if a person
Ayun.
touches a table,
Okay.
if a person touches an infected surface, just example is your telephone, your doorknob, or any surface, and then this person would touch his eyes, his nose, his mouth, ibutang yang iya kamot sa baba niya, ibutang yang iya kamot sa iya dalungan, that patient can be infected with coronavirus. Now, with direct contact, dapat ni ara ka direct contact sa pasyente nga infected. Like nagbeso ka mga duwa, nag-congratulation ka mga, nag-handshake ka mga duwa. So, a COVID patient nga imo gin-handshake, pwede ikaw malatnan. Now, some of the virus, if the infected person coughs, some of the virus goes into the floor. So what happens there? So if you are there walking and then natapakan mo ang virus, the virus stays on the sole of the shoes. And then you come home, dala mo man ang virus para sa dalom sa imong sapatos. It's very important that when you go home, leave your shoes outside the house. Going back to droplet transmission, take note, if the person cough, if the person sings or talk, the virus gets outside the mouth, it becomes suspended in the air for 3 hours. Take note, it is being suspended in the air
Three
for three
hours.
hours before siya manaog sa mga surface. Pag ubos ang pasyente mo, pag ubos ang COVID patient, some of the virus, some of the droplet nuclei goes directly into the table or any surfaces or on the floor. Some of the virus are being suspended sa air, in the air. So if they will be suspended in the air, the free floating sila dira for 3 hours before sila mahulog. So that's the mode of transmission of coronavirus. Any question? Okay, we will proceed. Next is, how about in poorly ventilated, crowded? Take note, it is very important nga, it is very important ang social distancing. Social distancing to pila gani
6 feet.
to to more than 2 meters, because within that 2 meters you are sure nga ang virus hindi maglabot sa imo kung mag-ubo ang pasyente. Hasta lang gid siya less than 1 meter bago siya mahulog sa floor. So, kinahanglan, you are 2 meters away from the patient or always observing social distancing. So what happens in poorly ventilated, crowded indoor setting? So if you are there inside a room with no window and then talking to a patient who is infected with coronavirus, and then that patient is asymptomatic, so meaning he does not know that he has the virus. So kung mag-ubo da siya, kung maghambal da siya, the virus is just there free floating on the area, galibot-libot lang, because there is no window. But the moment you open the window, the virus, the droplet nuclei is being suctioned out if you will open the window. How about in AC unit? AC unit, the air being used by air conditioned unit is also the air inside the room. So ginasuyop niya ang air pasulod sa aircon para magtugnaw. Pagbaon niya, nga tugnaw na. So if there is a free floating droplet nuclei that contains the virus, the AC unit would pick it up. Kag iya man ibuga palibot. And until now, the mode of transmission of COVID-19 is being questioned. There are a lot of research says that coronavirus is airborne. It becomes airborne. It becomes, take note, it becomes airborne only in the hospital. Any question?
Yes, sir. I have a question, sir.
Okay,
Tugbang.
Val.
Sir, sa rehab clinic nyo, do you open your window, sir?
Yes, we open our window. Every hour, we 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 follow air exchange. So may oras nga close siya para magtugnaw ang rehab. Siyempre, akalain man sa mga patient na nag-exercise. And then, nga init, take note, diba, isa sa mga factors when you do exercise, dapat i-check mo man kung ang temperature, sige, for a while, cease for a while. I'll get back to you, Okay. So, are you still there, guys? Ara pa ka mo?
Yes,
So with
sir.
regards
Yes, sir.
to Val's question, if we open the rehab, the rehab, yes, we do open the rehab. For 1 hour, i-close siya anay with aircons on. And after an hour, aircon will be turned off and open the window so that masuction ang old air sa sulod sa rehab. After an hour, i-close naman siya, kag-i-on naman ang aircon. That is what we are doing here at the rehab. And at 3 in the afternoon, if wala na patient, tanan aircon nga off, tanan nga window gina-open. Kaya para the next day, pag sulod sang mga staff, ang air limpyo na, pag una ang air sa sulod, so i-on na lang nila ang aircon. Muna siya ang ginaubra namon din sa rehab setting, sa rehab department. Same also with the other offices here at the hospital. They make sure that windows are open, doors are open. Okay?
Okay, sir. Thank you.
Ini
Good.
mga plastic nga ginabutang sa door, ini mga plastic nga ginabutang sa window, it decreases air ventilation. So dapat ginakwa na siya. And these plastics being placed on the door, being draped sa door, excuse for a while, another phone call.
Manabe na, takaran nila. Langkat lang kasi.
Yes, doc. Okay, okay. Yes, doc. Okay, doc. Thank you. Bye-bye, doc. Bye-bye. Thank you.
Yara.
So, Rigida, kay apat lang kami libong GP. So, kinanglan, isang pagkakit ang mga tawag. So, going back to the plastics, the plastic, I mean, being draped sa door, ang mga plastic na gina-drape sa window, ang mga plastic na gina-drape sa public vehicle, actually, they would harbor a lot of infection. So, it's best that these are being removed, especially sa mga window, kaya gina-decrease nila ang air ventilation. Sa jeepney, sa mga jeep, it's best nga maggamit sila sa fabric draping as fabric draping that would serve as distance from a commuter. Why? Because if we're going to compare plastic and fabric, if the virus gets in on the plastic and on a fabric, sa plastic, it would stay for 5 days before the coronavirus will die. But if it will get into a fabric on a tela, so mga like 2 days lang siya. After 2 days, mapatay siya. So it's best na ining sa mga public vehicle na instead of using plastic, they would use fabrics. Okay, so let's continue. Okay na? Do you still have questions, guys? Do you still have question? Okay na ta? Okay, so moving on. Okay, let's talk about incubation period. What do we mean when we say incubation period? Incubation period is the time where you are exposed to an infection and the appearance of the first symptoms. First symptom. Take note, 80% of coronavirus patients are asymptomatic, meaning they do not have any symptoms. They do not know they have the virus. Pwede sila mag-infect sa damo-damo ng mga tao. While the remaining 30% are symptomatic. Now, with incubation period, your MERS, your Middle Eastern respiratory syndrome, and then your SARS-CoV-1, the incubation period could be up to 14 days, the same as with your COVID-19 for 14 days. But there are patients that symptoms would flare up on the 21st day of quarantine, on the 21st day of isolation. That could be maybe secondary to a double exposure. You were exposed to the virus twice. That is why sa 14th day, hasta matapos ang 14 days, wala ikaw virus o wala ikaw symptoms, nagtuhaw lang ang symptoms after 21 days. So it is secondary to a double exposure. Now, what are the signs and symptoms of coronavirus? It is just like a typical flu-like symptoms. You wake up in the morning, feeling congested,
Malaise.
tutrang kasuhon ka, feverish, and then there is cough, shortness of breath, difficulty breathing, chills, muscle pain, body malaise, headache, and sore throat. Now, question.
Malay.
tanan ba lang ka symptoms nag-occur in one day? No. Adlaw-adlaw,
Gadto
day
ka.
1, day 2, day 3, day 4, amo na ang patterns ng pagtuhaw sang symptoms. Symptoms appears day by day. Take note of that. Pwede nga sang day 1, feverish ang patient. Then pag day 2, may fever siya, feverish siya, and then nagtuhawang iya cough. And then pag day 3, nadula iya fever. Nadula man ng cough, dito nagsulod ang headache. Dito nagsulod ang sore throat. Take note of that. Symptoms wala ga flare up, dululungan, but the symptoms occur day by day. Loss of taste or smell is common in COVID patient. There are patients nga may loss of taste but may smell sila. There are patients naman nga may loss of smell but may taste sila. 80.9% of these patients will experience mild symptoms and can recover at home, while the 13.8% of these patients would experience severe symptoms of pneumonia and shortness of breath, while the remaining 4.7% would experience critical symptoms coupled with respiratory failure, septic shock, infection on the blood, and multi-organ failure, and later on, if not reversed, the patient could die. There are other patient survives COVID-19. So after surviving COVID-19, so i-discharge sila sa COVID ward. Excuse for a while. Arna, thank you. So if may hara ka COVID-19, dito ikaw ibutang sa COVID ward. You will be there for like 14, 21 days. After that, in elderly patient who has comorbids, kung ma-survive nila ang COVID-19, so they will be placed on a regular room. Some of them dies secondary to the effects of COVID-19. So ano ning mga effects sa COVID-19? Mga post-effects ng COVID-19, some of them get stroke, some of them gets myocardial infarction, pneumonia, some of them get stroke, some of them gets myocardial infarction. Some of them would develop hospital-acquired pneumonia because of staying longer in the hospital. So if this hospital-acquired pneumonia is not treated properly, this patient could die. Take note of that. Other patient would experience Bell's palsy after surviving COVID-19. Diagnosis of COVID-19. How do we diagnose COVID-19? So these patients submit themselves to RT-PCR or your reverse transcriptase polymerase chain reaction, your RT-PCR. I know some of you experience kung paano gin-swab. So ginaswab niyo siyang RT-PCR. First, iswab ikaw sa oropharyngeal, dito pasulod sa imo nga sulod sa baba, oropharyngeal up to the pharynx. And then you will also be swabbed nasal swab. So nasopharyngeal, oropharyngeal. Kung nasal swab dito sa ilong pasulod. So they would use a very thin, it's like a cotton buds, a very thin cotton buds for the nose, for nasal swab. And then if oropharyngeal swab, medyo damulgawa ang cotton buds ka na. Take note ha, if you will submit yourself to RC-PCR, always look for the swab that will be used. The thin swab is for the nose, while the thicker swab is for oral swab. Now, this RT-PCR is the gold standard in diagnosing COVID-19. Result could be out after 24 hours. Result could be out after 2 days, 3 days. In the hospital, aside from RT-PCR, we make use of saliva test. Your saliva test is actually not a gold standard, but the, the efficacy, the sensitivity, the reliability is the same as with your RT-PCR. So that patient will be given a tube and then ikorektahon niya iyang laway sa baba. And then the patient will dupla on the tube. So may desired line na siya kung diin asta dapat butaon sa laway. And then after that, i-close na siya and then idalon siya sa laboratory kag i-check if there is coronavirus. For immediate admission here at the hospital, if the patient really needs emergency care, like for example, na stroke ang patient, and then wala RT-PCR ang patient, lipong ang patient, GCS 5, 6, comatose ang patient, hindi mo siya mapadupla for ano, kaya ang actually ang saliva test is after 24 hours ara ang result. So for immediate admission, we make use of biofire. Excuse me for a while. Rehab department, good morning. Joseph speaking. How may I help you? Yes, Doc. Doc? Yes, Doc. Pati ang Doc. Oo. On ng okay man, oo. Naka-broadcast na. Oo.
Apat lang sila nag-duty sa buong. Ano? Apat lang sila nag-duty sa rehab. Wala di kagwa-gwa sa permi. Ha? Gagwa-gwa siya, ida mo katawag. Hoy, ara pa. Pila na yan, suldo, sa St. Paul, dira sa... Pero hindi, kita guro gusto rin dyan. Tauhay tanin, no? Kung magano na siya, no? Tulaghali na di siya, no? Hindi man na... Bagay. Oo. 5,000.
Ang isa nga pa pala, sir, for consent, tapos ang isa, ako na, ako yapon. Ako na to, ang ito, kung ito, ito. Okay, Di mo tayo na. Okay. Okay, sige, sige, round again. Guys, sorry to do that. Okay, let's proceed. Let's continue. So, immediate admission. So, if the patient will be admitted here at the hospital and that patient does not have any RT-PCR result, let me check on you. Okay, if that patient does not have any RT-PCR result, the patient will undergo biofire. The biofire is a test here at the hospital para insigida ma-admit ang patient. Ipag swab sa patient, nasal and oral, result will be out in 2 hours, 3 hours. So that's the nature of biofire. And what happened to Renee? Wala na siya.
Excuse me, sir. May I ask a question?
Yes, is this
Carmela, sir.
Carmela? Yes, Carmela.
Yes, sir.
Uh-huh.
So we know, sir, that for ER patients and emergency patients, like they would need to be tested. How about, sir, for rehab patients?
Okay.
Do you still recommend?
Ano man, shall I say this? With here at the rehab department, we take our patient with level 4 PPE. So to make sure that if the patient has the virus, if the patient is asymptomatic, we are protected with the PPE. I cannot give a lot of information on how we deal with our patient. What is good is that we use PPE when treating patient. So if that patient finishes his or her therapy, so we discharge the PPE. Another patient comes in, we get another PPE. Okay? There are patients nga nagka-COVID sila. There are patients who gets infected with COVID but outside. Nga like after 2 days, makibot lang kami, admitted na sila diri sa St. Paul's. And we are not tagged as close contact. So we do self-monitoring for 14 days. Duty kami yapon, self-monitoring, and then you will not be submitted to swabbing. You will only get swabbed if you will have symptoms. Take note. This is not only in St. Paul's Hospital, but in other hospitals, in other private hospitals. With regards to swabbing the patient, I cannot give a lot of information about that. Sorry. Okay? Okay lang?
Yes, sir. Thank you, sir.
Okay.
Sir,
Uh-huh.
pwede
Who
ka
is
ask,
this?
sir? Hansel Cheng, sir.
Hansel. Yes, Hansel.
Sir, di ba, bisan sa buwang treat ka mo, sir, inpatient, sir?
Yes.
But, okay. Kung sa inpatient, yes, sir, ang patient, sir, they require nga
Yes.
mag-RT-PCR.
Yes. Kinahanglan. Kung nagsulod ang patient for immediate admission, as what I mentioned, Gina, di ba, why siya di RT-PCR, pero nag-biofire lang siya. Kung nag-negative siya sa biofire, and then gin-admit siya, na-ICU siya, na-stroke siya, gin-ICU siya, and then later on, gin-refer siya for rehab, we do rehab. Basta negative ang biofire. Basta negative ang RT-PCR. We don't do physical therapy kung wala na swab ang patient. Now, what if the patient is COVID positive and was referred to physical therapy? The Infection Control Committee did not include physical therapy as a primary care for COVID patient here at the hospital, here at St. Paul's. I do not know in other private hospitals if they do physical therapy for COVID patient. But in preparation, if ever kinahanglan gid na physical therapy ang COVID patient, we will do tele-rehab, provided that the patient can follow, that the patient has a companion inside the isolation room. So amo na ang amon nga gina-prepare if ever nga may ara gid man i-rehab nga COVID positive diri sa patient. We will do tele-rehab. Okay? But
Okay, thank you, kid, sir.
Yes, you're welcome. But in other region, I do not know if they do physical therapy. But in the US, they do physical therapy. We have senior staff, alumni, PPs, dito sa hospital nga nag-work na dito sa nga nag-work dito sa America. May mga times nga si Doc nagapa Google meeting sa amon, and then Dr. Cabrera will invite physical therapists, alumni physical therapists, and they share their experience with COVID patient. They do physical therapy in COVID patient. Okay, so let's proceed. Question: what if nagsala ang RT-PCR sa patient? Nag-negative, pero in reality, the patient has the virus. Amo na ang pinakadako nga problema. Muna nga naa, hindi pwede ang COVID antigen. Hindi pwede ang rapid test. Dapat ang gold standard gid ang ginagamit. Now, kung magsala ang RT-PCR, nag-negative siya, pero may ara siyang virus sa lawas niya, amo na ang pinakadako nga problema. So far, wala pa man na natabo dito sa hospital. Pero may natabo na nga nag-negative siya sa biofire, gin-admit siya, naglaway siya, gin-RT-PCR siya, nag-positive siya sa RT-PCR. That is what happened in a floor here in the hospital, 3rd floor to be specific. The patient, for immediate admission, does not have RT-PCR. So the patient underwent biofire para ang results ng biofire ara dayon after 3 hours. So yung biofire ang patient, gin-swab siya, nagwa ang result after 3 hours, negative ang patient. So gindala siya sa room. So nurses gets inside the room, gets the medicine, gets the blood pressure, only wearing mask and face shield. After how many days, the patient got ill. Nagmasakit ang pasyente. Nagsakit ang katunlan, nag-fever. So the patient was swabbed, RT-PCR. RT-PCR came out positive. So during that time, I think that happened this year, maybe a couple of months ago, 3 to 4 months ago, wherein all 30 floor staff were quarantined, and then some of the nurses on the other floor reinforced third floor. So we are praying that it will not happen again, knowing that the census of nurses in all private hospital are decreasing. Nagasilo sila sa public hospital. Kay balaan nila, naku ang sweldo nila dito. Nagasilo sila sa public hospital. So nagagamay ang census ng nurses sa mga private hospital. Okay, let's proceed. Classifications of symptoms. Paano mo maklasify ang patient if mild, moderate, severe, critical? We classify a mild COVID if the patient has signs and symptoms of COVID-19 but without SOB, without dyspnea, or without abnormal chest imaging. So anong makita sa chest ng patient? Anong makita sa x-rays ng patient? Pneumonia. SARS-CoV pneumonia. I forgot kung ano ang term. Maybe Gab can ask her mom. Her mom is a pulmonologist. I-ask niya lang next time. I think the image of the lung is like a glass, a broken glass. Doon nabuka nga glass sa sulod. Doon nabuka ang glass, ang image ng lung sa x-ray sa COVID patient. But I'm not sure ha, basi isa lang ko. Nagasulod pagit sa ulo ko the broken window. Saan mo na siya. Mild symptoms. So you will say that your COVID is mild if you have signs and symptoms, but you do not experience SOB, there is no dyspnea, there is no abnormal chest imaging. Let's proceed to moderate COVID. You get to classify a patient, moderate COVID, if there is evidence of lower respiratory disease by clinical assessment or imaging. Makita mo na ang pneumonia sa iya nga baga. Next, with oxygen saturation of greater than 94%. Taas pa ang iya oxygen saturation. Now, if the oxygen saturation is more than 94%, the patient is still cannot candidate for intubation. What is this intubation?
Tubo.
So they would get a tube, they would insert the tube inside the mouth, they would attach the tube into a ventilator to drive the oxygen inside, going directly to the lungs. That is intubation. So with patient who has moderate COVID, they don't need intubation, but some of them needs oxygen. So they will be attached to an O2 cannula. Let's proceed. Severe COVID. You get to say that the patient has severe COVID if the respiratory rate is already more than 30. There is a sudden decrease in O2 saturation of less than 94%. Lung infiltrates characterized by pneumonia. So the lung infiltrates more than 50%, covered ang lungs, 50% sa infiltrates. This patient is now candidate for intubation. There are patients who are difficult to be intubated, especially if the neck is short. So kung nubo ang imo nga liog, budlay kasudlan sang tubo. So what they do is they put the patient in high flow oxygen. Butang lang sa ilong 100%, no, not really 100%. Butang lang sa ilong ang mask, and then they would give high flow oxygen. With decreased O2 saturation, less than 94%, the patient is already candidate for intubation. Excuse for a while. patient is already candidate for intubation. Now, what comes next? Critical symptoms, critical COVID. The patient will be classified as critical COVID if the patient will undergo respiratory failure.
Masudan ma.
The lungs, the pulmonary
Ha?
system will not
Ha?
work anymore.
Hindi, subong pa ma.
Septic shock, infection on the blood,
Okay.
or multi-organ
Ano ganito doon?
dysfunction. What happens next? Death. If the patient, if it will not be reversed, kung hindi matatapan ang patient with critical COVID, the patient could die of COVID-19. Amo ning katabo sa mga patient nga may mga comorbidities. What do we mean when we say comorbidities? Patient with cardiac disease, all types of cardiac disease. Patient with asthma, I have asthma. Patients who are hypertensive. Patients who have cancer. Patients who have all types of underlying disease, HIV,
Wait, ano na?
AIDS. If matapikan sila sa COVID, kung hindi sila mabulong mayo, hindi sila matatapan, they could experience critical COVID. They could undergo critical COVID. And kung law-ilaw ay nagid, wala taman ginapangayo, maybe they will die. Fatality rate. Let's talk about fatality rate. Now, if you can see the table, the older the patient, taas ang fatality rate nila compared to younger patient. 10 to 19, 0.2% only. But for 80 plus years old patient, taas ang fatality rate nila, 14.8%. 0 to 9 years old, no fatalities. But take note, this data was taken in 2020 when Delta virus resurfaced. When Delta virus surfaced in India, ang gina-infect subong sang Delta virus kag ang iya nga if hindi matreat maayo ang kabataan 0 to 9 years old, taas ang ilang fatality rate. Take note. The Delta variant of COVID-19, taas ang fatality rate sa mga kabataan. I do not know why. I do not know what's with Delta na ang iya gina-atake ang mga kabataan. Let's talk about death according to gender. Taas ang death rate sa male gender compared to female. I do not know why. It's not only in SARS-CoV-2 but also in SARS-CoV-1 and MERS-CoV. There is an increased death rate in male gender compared to female. How about pre-existing condition or comorbidities? Death according to pre-existing conditions or comorbids. Take note, patients with cardiovascular disease, taas ang ilang death rate, 10.5%. Cancer patient, medyo nubo gawa. Hypertension, chronic respiratory disease, dila di ang mga asthma, mga COPD, tanan nga problems sa respiratory disease, and also diabetes mellitus. Diabetes mellitus is also a comorbid. Compared to pre-existing condition, medyo nubo ang death rate. Pero question, naaga kapatay sila kung wala sila comorbids. Naaga kapatay sila kung wala man sila cancer. Naaga kapatay ang pasyente, wala man siya hypertension, wala man siya diabetes mellitus. And that is secondary to infection. Take note, secondary to septic shock, infection in the blood. Treatment for COVID-19. There is no known treatment or medicine for COVID-19. So if the symptoms would flare up, you just treat the symptoms. If the patient has sore throat, give medications for sore throat. If the patient has fever, give paracetamol. There was the World Health Organization approved 2 drugs that can be used in treating COVID-19 patients, especially those experiencing severe and critical COVID. So this patient with severe and critical COVID, pwede sila matagaan ng tocilizumab or remdesivir. Take note of this drug, tocilizumab, remdesivir. These are the drugs approved by World Health Organization that can be given to COVID patient to speed up the recovery of the patient. Your tocilizumab is given intravenously, so i-inject sa patient. Your tocilizumab is a primary medication for patients with rheumatoid arthritis and systemic juvenile arthritis, while your remdesivir has been used a long time ago na when SARS-CoV-1 and MERS-CoV surfaced. So nagkuhaw ang imong SARS-CoV-1 kag ang imong MERS-CoV-2, gingamit na ina ang imong remdesivir. Now, how much is tocilizumab? Take note of this. Mahal ang tocilizumab kag ang remdesivir. Your tocilizumab would range approximately up to 15 to 20,000. 20,000 to 30. Same as with your remdesivir. Mahal-mahal din sila ng mga bulok. Kas-a, kaduwa pa tagaan tocilizumab ang patient. There are times kaduha pa i-injectan remdesivir ang patient. We are just lucky that if COVID patient is admitted, it is the PhilHealth that would cater the hospital bills. Amo na siya diri sa amon sa St. Paul's. I do not know with other hospital. There are other hospitals nga kung wala sila bulong, mabakal sa buwa. Ang ila bakun sa buwa, wala gina-reimburse sa PhilHealth. But here at the hospital, if there is an available tocilizumab, if there is an available remdesivir, the folks buys the medicine and then it will be charged lang sa patient. And then if the patient will be discharged, PhilHealth will cater the bill. Depende kung ano ang symptoms mo. My aunt died. My aunt died in July this year. Her symptoms was classified severe COVID. In PhilHealth, severe COVID, ang ilang coverage is 700,000. So our bill when my tita died, kag na discharge, our bill is 200,000. It was covered by PhilHealth. Now let's talk about variants. Why do we have variants? Ano ni mga variant kani? Kinaas ang una ang MERS-CoV, wala man variant. Ang SARS-CoV-1 sang 2003, wala man variant. Na ining COVID-19, ang SARS-CoV-2, naamiyata siya yung variant. In UK, there was a sudden increase in COVID case in UK last year in 2020. So they did a genome sequencing. So they got a virus, a live virus inside the body or whatever kung paano nila ginkuha ang virus nga nasa lawas ng patient. So they did genome sequencing. What happens there is the mutation is not on the cellular body itself, is not on the genetic, on the genes or on the DNA of the virus, but the mutation happens in spike protein. So diining imo nga spike protein. The spike protein of your SARS-CoV-2 is amo ni siya ang do iya nga appendages. These are your spike protein. This spike protein also contains genetic material of the virus. Now, after genome sequencing, diri nila nakita nga diri gali katabo ang mutation sa coronavirus, ng SARS-CoV-2 sa spike protein. Take note ha. The mutation occurs in spike protein on the surface of the virus, the spike protein, and not on the body, not on the inside, not on the DNA material of the virus. Now, to minimize discrimination of the country, World Health Organization make use of Greek alphabet to name COVID-19. So with UK strain, they addressed it with Alpha variant, the South African, the Beta, the Brazil variant, your Gamma, duwa sa kabilog with P1 and P2. Their Brazilian strain was called your Gamma, and it has two types, your P1 and then your P2. And the ever famous Indian virus, the Delta, which is now the most common virus that circulates in every continent, the Delta virus in India. All of these four are called your variants of concern. Why variants of concern? Because they have the possibility to give a great impact on the country, economic, healthcare, health system, whatever. That's why it's called variants of concern. Now we have variants of interest. Variants of interest. We have your Nigerian and UK strain. Again, UK. It's called your ETA. Hello. Naganusyo. Ano pa ko? Can you still hear me?
Yes, sir.
Yes, sir.
Yes, sir.
Okay, right na. Ulit na siya. Next, we have your Theta. Was found here in the Philippines, or the Philippine variant. Take note, your Gamma has two types, your P1, your P2, your P3 now becomes your Theta of the Philippines. There is also a USA variant. I don't know how to pronounce this, IOTA. I don't know. Basta muna siya. It's your US variant, American variant. And another variant in India. Nag-mutate na naman ang Delta. It becomes now your Kappa variant. Now, the new variant that mutated this year was found in Peru and in Colombia. Your Lambda and then your Mu. Okay, so these are your variants of concern, while these are your variants of interest. Now let's proceed. Where does mutation occurs? Mutation occurs on the spike protein of the virus. Take note, on the spike protein of the virus, not on the body of the virus, not inside the virus, not on the genetic material of the virus, but the spike protein. And this spike protein also contains genetic material. What happens during infection? So ara ka dara, galakat ka, sa kilid sa dalan, may tawo nga ng hatsi. Lakat ka, nauhaw ka, panaog mo imo nga mas, nag-inom ka tubig. Wala ka kahibalo, sa agin-agyan mo, nagtindog ka dira sa madugay, nagtindog ka da for at least like 10 minutes, kaya hulat ka sa jeep, dira man yung area, nagkatsi ang tao. Karon, the virus becomes free-floating, ara lang da, nahaklo mo siya, naginhawa mo ang virus. What happens? The virus gets into the body. This virus, your SARS-CoV-2, has greater affinity on a specific receptor. This is your ACE2 receptor. Your ACE2 receptor is found all throughout in the human system, in the human body. On the lungs, on the liver, on the kidney, anywhere else. Your ACE2 receptor. Now, if the virus gets inside the body, kung may nakita siya nga ACE2 receptor, dito siya makadto. Matapik siya sa ACE2 receptor. Because you inhaled the virus, Makato sa ilong ang virus, madiretso sa lungs. Your lungs, the pulmonary system, has ACE2 receptor. What happens next? Kaya nagtapik siya sa ACE2 receptor. So this is your ACE2 receptor now. The virus gets inside the cell, gets inside the cell membrane. Pagsulod sang virus, the virus will release its DNA. The virus will release its DNA content, DNA content sa sulod sang cell membrane. Ano matabo dayon kung kin-release ini sang virus ang ilang DNA strand, ang ilang genetic code. This genetic code gets inside the nucleus. Happens next. Take note, your nucleus is the houses a lot of genes. It is where productions of genes happens in nucleus to make a lot of copies of cell. Now, if this genetic material of SARS-CoV-2 gets inside the cell membrane, it goes directly to the nucleus. Ari na, nucleus. Masulog ako sa nucleus. What will happen next? The genetic material of the virus gets inside the nucleus and will do a reverse transcriptase. Take note, you may have forgotten what reverse transcriptase is because it was discussed a long time ago in your physiology. If this is the normal transcription of the message, when the virus gets in, there is reverse transcriptase. I will take command of the nucleus. Happens inside there, take command ko ang nucleus para magdamo pagid ang virus nga ma-produce sa lawas. After such, kung damo na virus nga naubra dito sa nucleus, it gets outside the cell. The virus gets outside the cell. Once the virus gets outside the cell dies. There is cell suicide. You can still remember cell death. Is it apoptosis? Tama. Cell death. Cell rupture. I hope I'm correct. Cell death, apoptosis. Now, if a lot of virus has been engineered inside the nucleus to reverse transcriptase. Pagwauna sila ni sa nucleus, pagwa sa cell membrane to infect other cells. That is why if you are exposed to a virus, the next day, hindi ka pwede maswab. Kaya wala pa damo-damo nga virus sa imo nga lawas. Kinahanglan, after 5 to 7 days, dira ka pa iswab para ma-ensure nga damo na virus sa lawas mo. That is what happens when the virus gets inside the cell membrane. After that, incubation period, symptoms would flare up. Any question? Okay, good. Okay, can you understand?
Yes, sir.
Okay.
Yes, sir.
Okay. Sige, we will go on na ha. Now let's talk about vaccines. These vaccines being used are the activated forms of germs like viruses or bacteria. It can be injected intramuscular. It can be taken orally. It can be sprayed on the nose. These vaccines are used to create antibodies so that in the future, if a virus gets inside the body, the antibody inside the system, the antibody produced for that specific virus knows how to respond, knows how to fight the virus. Okay, there are 3 types of vaccine technology in creating your COVID vaccine. The first is your mRNA vaccine, messenger RNA. What happens with messenger RNA? So they will take the scientists, the doctors, or the genetic engineers would take a virus, a deactivated virus, and the specific area, the specific structure on the virus that they will use is the spike protein. So they will take this protein, they will harvest this on a deactivated virus, the spike protein. The spike protein contains genetic material. Take note. This is not just a protein, but it also contains genetic material. Now, after taking this spike protein, it will go into a lot of process. So there is a sterilization, there is radiation or whatever kung paano na nila engineer ang spike protein. These spike proteins, these spike protein will be used sa vaccine. So it will be covered with a protein particle also para hindi siya madegrade. So once an mRNA vaccine is inoculated into the system, into the muscle of the patient, the mRNA vaccine gets inside. Take note when we say mRNA, messenger RNA, it contains message and instructions. What are these instructions? It contains instruction nga mag-teach sang imo nga cell to produce viral protein, to produce large amount of spike protein. So isa lang kabilog ang ginkwa nila, gimbutang nila sa protein coating, ginsulod nila sa vial, gin-inject nila sa imo. Pag-inject nila sa imo, that spike protein also contains genetic material, contains mRNA, and these mRNA will be the one to teach your cell how to produce a lot of spike protein or viral protein. Once injected into the muscle intramuscularly, i-inject mo na ang imo nga mRNA. The protein covering, the protein coating breaks up and releases the genetic material of the spike protein, the mRNA. This is now the genetic material of the spike protein or the mRNA. Where do you think it will go? Will it go to the nucleus or will it go to a ribosome? Take note, in mRNA, the mRNA does not go inside the nucleus. It will travel to look for ribosomes. What is the function of ribosomes? Ribosomes is the one responsible in translating mRNA and also the one responsible in synthesizing amino acids, turning them to protein. Now, the mRNA vaccine gets inside the cell membrane. The mRNA releases its genetic material, the mRNA. This mRNA travels to a nearby ribosomes. After traveling to a nearby ribosomes, it will teach the ribosome to please help me replicate or make a lot of spike protein. So the moment the mRNA gets into the ribosome reads the information. The ribosome creates a lot of spike protein. Now you already have spike protein. Spike protein nga pareho gid sang spike protein sang SARS-CoV-2. After this spike protein has been manufactured, these spike proteins are being goes out in the cell membrane and being exposed on the surface of the cell membrane. So ara sila dao. ang mga spike protein mo gimpagwa sila sa imo nga cell. Dara lang gid sila sa surface ng imo nga cell membrane. They would act as a receptor. Do receptor ang ilang atsura. So after that the cell membrane exposes the spike protein sa surface nila, what happens next? Next, immune response takes place. The first line of defense happened, tissue macrophage. Tissue macrophage gets in, senses that these spike protein produced by your ribosomes are alien and are new and does not belong on the body. So they would go into that spike protein along with a lot of immune cells. Along with a lot of immune cells, your neutrophil, your eosinophil, your basophil, as well as your memory T cells. It is important that ara gid permi ang imo nga memory T cells because these memory T cells will be the one responsible in nga para hindi niya malipatan the next time kung magsulod-liwat ang amo na nga virus, may panglaban siya. Now, as an immune response of the immune cells, they will create antibodies against SARS-CoV-2. Antibodies against SARS-CoV-2. So, ara na vaccine ka na. After 5 months, after 6 months, 3 months, na-infect ka sa coronavirus. And these are the antibodies made by the immune system against the coronavirus. The coronavirus gets inside the body since you are vaccinated. So these antibodies will get into the receptor, into the spike receptor, into the spike protein of the virus. What will happen next? These antibodies will neutralize the virus so that ma-disintegrate siya, mapatay siya, kag hindi na mag-cause infection. That is the technology of mRNA vaccine. Your mRNA vaccine is your Pfizer BioNTech. So Pfizer BioNTech used the mRNA technology with efficacy of 95% against US, UK strain, South African. And there are already studies that came out this year that it is 90% effective against the Indian strain. Your Pfizer BioNTech dosing, 2 doses, So during your first dose, you get a 0.3 ml, 0.3 ml only. And then after 21 days or after 1 month, you get another second dose. Your Pfizer BioNTech was manufactured in Germany and in US. Another mRNA vaccine is your Moderna with efficacy of 94% against your US, your UK, and your South African strain. Dosage is 2 doses. Your first dose, you will receive 0.5 ml intramuscular. You will receive your second dose 28 days after. So your Moderna was manufactured in US, in the United States of America. In a Canadian study this year, 2021, it is 75% against Indian strain. Now let's talk about another technology. The next technology used in preparing, in making a COVID vaccine is your viral vector. What do you mean when we say a viral vector? They would use another virus so that the inactivated coronavirus will get inside that viral vector and would act as a camouflage. So in a viral vector, the most commonly used virus as a vector is your adenovirus. I do not know why adenovirus. Maybe based on my study, they would make use adenovirus because it has lesser, though hindi naman kagrabe ang infection sa lawas ng tao. and then this viral vector also was deactivated. So with viral vector, they would make use of adenovirus. This is the whole virus. The viral vector technology does not make use of the spike protein. Amo ning difference nila sa mRNA. mRNA make use of spike protein, but your viral vector makes use of the DNA of the RNA of the virus and the RNA of the viral vector, the adenovirus. What they will do, what are they going to do? They will fuse the DNA of the adenovirus and the DNA of the coronavirus. So let's take, for example, this is the DNA or the genes of the adenovirus. So they will slice apart, they will delete apart, they will remove apart. Ano ning part na ila i-remove? The part that they will remove is the instructions that would instruct the cell to replicate a lot of adenovirus. So they will remove that part. What? Ano nga part sang adenovirus gene ang ila i-remove?
Instructional part.
The gene that they will remove is the gene that is responsible in replication of adenovirus. What happens next? So ano yun kung i-remove nila ang gene nga na? They will replace that gene. In replacement, they will also cut apart, they will delete apart on the coronavirus, on the SARS-CoV2, and this deleted part will replace dito sa adenovirus nga ila ikuha. So they will fuse the DNA of the adenovirus and the DNA of the SARS-CoV-2. After doing series of genetic engineering, a lot of scientific process, they will place this gene inside balik sulod sa adenovirus. Happens next. Now they will place this viral vector in a vial. They will inoculate the vaccine. The same thing happens with mRNA. So there will be production of a lot of antibodies. There will be immune response. The same process happens in mRNA. So that is your viral vector. Example of your viral vector is your Oxford AstraZeneca vaccine. Oxford is the university that manufactured your AstraZeneca. Oxford University. The drug is the AstraZeneca company. Ang naghimo sang vaccine is the Oxford University. It has efficacy of 82% against US and UK strain. And this vaccine is given to senior citizen or elderly patient. So what happens if a non-elderly patient receives AstraZeneca? So these non-elderly, teenager, adult will actually react to AstraZeneca. It's like na do natrangkaso sila, do ginhilanat sila. So the efficacy of AstraZeneca is 82% against US and UK strain. Dosage during your first dose, you will receive 0.5 ml, and then on the second dose, another 0.5 ml, and you will receive it after 8 to 12 weeks. That's your AstraZeneca. There are studies made in 2020 this year that AstraZeneca gives a long time protection against COVID-19. On my study, I haven't read if the viral vectors and if other vaccines can also give long life protection. So it is said that the AstraZeneca can give a long life protection against COVID-19. Your AstraZeneca was manufactured in UK. Next is your Johnson and Johnson's Janssen. So your Janssen is another adenoviral vector vaccine. Efficacy 70 to 82% against US and UK strain and other strain also. One dose only, 0.5 ml. Was manufactured in US. So these are the vaccines nga din panghatag last 1 to 2 months. Your Pfizer and then your Janssen. Your Janssen is dapat inahatag siya sa elderly, but a lot of adult and young ones receive Janssen. But that's okay. The next technology that was used in making a COVID vaccine is your protein subunit. Medyo mautigawa ang process nila. So with protein subunit, the structure on the virus that they will use now is again the spike protein. They will not use the DNA of the virus because the DNA is used by your viral vector. In protein subunit vaccine, they will use a part of the pathogen, a part of the virus. And this part of the virus is your spike protein. Ara siya. So to magnify it, amo ni makita mo sa spike protein sa coronavirus. What will they do next? After removing this spike protein sa surface ng SARS-CoV-2, they will place it on a bacularius virus. What do you mean when we say bacularius virus? Your bacularius virus is a virus that infects insects. Pwede man nila ibutang ang ining subunit sa yeast. Pwede nila ibutang ang ining protein, spike protein sa bacterial cells. But in protein subunit, COVID vaccine, they make use of insect virus. Ano brahon nila dira? They will place this protein subunit in an insect virus known as your baculovirus. What happens next? So they would inoculate this protein subunit in an insect virus. So ara na siya. After inoculating this protein subunit in the insect virus, known as your baculovirus, it will replicate. It will undergo replication. Ma-replicate sila, damo-damo nga spike protein. Mag-replicate sila. After the insect virus replicated a lot of spike protein, they will be harvested. They will be removed on the insect virus. They will be harvested. What happens next after harvesting these replicated spike protein? They will undergo sterilization. They will undergo a lot of process, filtration, sterilization, and a lot more. Kumbaga, i-sterilize sila. I forgot the term. Basta i-sterilize nila ining mga nag-replicate ng mga protein subunit. What happens next? After process of sterilization and filtration, these subproteins, protein subunit, these spike proteins are being placed in a vial. Isulod sila sa vial. What happens next? Hindi pwede nga spike protein lang ang sulod sang vial, sang Novavax, kag sang imo nga Sputnik 5. Ila ini ginabutangan sang adjuvant. What is this adjuvant? The adjuvant used in protein subunit is called your matrix M. This adjuvant would increase immune response if this vaccine is being inoculated in the human body. Without this adjuvant, ang immune response ng lawas, nubo. I do not know why. I do not know na anubo ang immune response ng protein subunit. Amo na nga naa kinahanglan nila sa adjuvant. So they would place the adjuvant on the vial so that when you inoculate this vaccine into the system, in the human body, the immune response will increase. That is your protein subunit vaccine. After injection, what happens next? The same process, immune response, formation of antibodies. Example of your protein subunit vaccine is your Novavax. Novavax with efficacy of 93% effective against all variants. It has 2 doses. I haven't seen how many ml is given to the patient. It is 2 doses and then 1 month apart. It could be siguro 5.5 ml man base pero wala ko may nakita nga source kung pila ka the dosage ang Novavax. 2 doses, 1 month apart, and it was manufactured in USA. Now, the famous of all is your Sputnik 5 that was manufactured in Gamaleya University. So the Sputnik 5 could also be called your Gamaleya vaccine. It has a very high efficacy against 93. It has a 91% efficacy against US and UK strain. So if you will compare your Novavax and your Sputnik 5, mas taas ang efficacy sa imo nga Novavax. Dosage, 2 doses, 0.5 ml, 28 days apart. Was manufactured in Russia. Take note of this Sputnik 5. Ay, niyara pa. There's another vaccine technology. This vaccine technology is the inactivated virus. This is what the Chinese did in making their virus, in making their vaccine. The Sinopharm and then your Sinovac. So what they did is they got the virus, the whole part of the virus. They will grow them in the lab for replication. After growing this virus, they will sterilize the virus. They will deactivate the virus. The whole virus are deactivated, including viral protein, the spike protein, and the genetic material. So wala sila yung gagamit sang spike protein nga amo ni. Wala man sila gagamit sang gene sang virus, sang DNA sang virus, but instead they used the whole virus. It's just that they deactivated the virus through the process of sterilization, through the process of radiation, and then they would put specialized chemical. I haven't researched. Wala ko nakita kung ano ini ang chemicals nga ilaging gamit. It was only mentioned that they used a specialized chemicals. Specialized, yes. Wala kasi ko siya. Ano oras naman? Okay, sige. Tapusin ko lang eh. So they use a specialized chemicals. What happens there? So they would put this inactivated virus and special chemicals on a vial, and then once inoculated or injected into the system, it produces immune response, same as with your mRNA, with your protein subunit. Produces immune response by producing a lot of antigen. A lot of antibodies against coronavirus. So that the next time is so that in the future, if the virus gets into the body, you already have the antibodies against that virus. They will neutralize the virus. They will not get you sick. Okay, this is your example of these are your Sinopharm with 79% efficacy against US UK strain, 3% effective against South African strain. Dosage, 2 doses, 0.5 ml, 3 weeks apart. It was manufactured in China. And as well as your Sinovac with efficacy of 50% against US and UK strain. Tama ka lubos ang Sinovac. Dosing, 2 doses, 0.5 ml, 3 weeks apart, and it was manufactured in China. I think I have to end ang akong lecture, and we will continue with the lecture in the afternoon at 3 p.m. Will that be okay with you guys? Will that be okay with you? 3 p.m.
Yes, sir.
Yes, sir.
Yes, sir.
Okay.
Yes,
So
sir.
if you have questions, about the vaccines, let's talk about that this afternoon. Okay, 3 p.m. Okay. I see you. Thank you, guys.
Okay, sir. Thank you,
Bye-bye.
sir.
Thank you.
Bye. Hello.